We found that over the 5 years looking at public Medicare data in Australia, that there were roughly 22 to 23,000 hysterectomies performed. And we know that from the literature, roughly 30% of hysterectomies are performed for fibroids. So we would expect to see around 4,000 to 5,000 hysterectomies performed for fibroids. But in the same period of time, over 5 years, there were less than 150 uterine artery embolisations performed for Australian women. And that is a huge disparity. I think the data in the UK and the US must be very similar, but I don't know the specific details. I think that uterine artery embolisation is an underutilised procedure around the world. And in fact, having societies and institutions such as NICE putting within their guidelines that uterine artery embolisation should be performed because it is an efficacious procedure certainly does help, but we're still seeing in many different jurisdictions a lower amount of uptake of this treatment to women. It's interesting that a procedure has been proven to be efficacious and there are proven benefits over surgery. There must be a reason why this is not taken up worldwide. And I think a lot of this may come down to patient awareness and referrer awareness. Quite often women may not be aware of this procedure that's available to them, or that when they go and see a obstetrician or gynecologist, that they get quite often surgery but not the option of having uterine artery embolisation. So I think it's important to be able to get the message out there to not only just the patients but to our referrers, to tell them that this is an efficacious, proven technique that certainly has the capacity to help lots of women worldwide. I think what's important is that we may need interventional radiologists from all jurisdictions from across the world to come together, work with their societies to try to produce some sort of media release perhaps, or initiative to help educate the women and referrers around the globe for this treatment, because I think that a lot of women are really missing out on uterus-sparing surgery for fibroids.